Autoimmune neurology is an entity that's really changed dramatically over the past 20 years. Traditionally, physicians would commonly recognize disorders as being potentially immune-mediated, but we really didn't have any good biomarkers, and it was very much based upon clinical history-taking, imaging, and oftentimes the administration of some type of immunotherapy to see if a patient might get better.
Dating back almost 4 decades, we have developed expertise in developing diagnostics for autoimmune neurological diseases, reporting out antibody test results, seeing patients with these disorders. And so there's been very much a back and forth between our laboratory and a world-class neurology department.
I think the foundation has been established by really the pioneers in the field. And one of those pioneers was Van der Leyen, who essentially was the founder of the Neurology Laboratory at Mayo and has made significant contributions in the understanding of autoimmune neurological disease.
When I came to Mayo in '78, it was to establish a basic science lab, a bit translational, because I was in the Department of Neurology doing immunology. I set up the acetylcholine receptor binding antibody assay as an evening activity in my research lab for the neurologists at Mayo. And pretty soon, physicians outside neurologists were mailing in serums.
What separates us from the competition? Very simply, we're a clinical service laboratory that's run by clinical neurologists. We've got a great team of individuals, and we're there to provide a service.
A neurologist on call 7 days a week for the lab to provide interpretive expertise over the phone, because sometimes, a patient may be an extremis in an intensive care unit setting and they're looking for any available information that we can provide.
We're actually a group of scientists who are interested in disease, and we're commonly in contact with 5 or 10 neurologists every day from all over the country, assisting them in the interpretation of not only the classifiable antibodies that you order, but also the many that we're seeing that we don't definitively report out. In fact, more than half of the antibodies we detect in the lab are unclassified antibodies. It's very, very exciting, but each new discovery results in thinking about how do we optimize the assay to detect that antibody.
Clinicians are great at looking for patterns and looking at pattern recognition. We're used to doing that from the clinic, and we're really just transferring that expertise into clinical laboratory space. That's not something that you learn overnight. That's something that's gained with experience over years. We're not looking at one piece of tissue, we're looking at tissue composite, where there are so many different reference points, and we're combining all of those into different permutations and combinations, which would represent then a very specific staining pattern for an antibody.
But the most important thing is that these evaluations, if they're positive, can potentially direct the physician not only towards understanding the underlying mechanism of what's going on in the patient, but direct the physician towards initiation of a treatment that potentially can reverse and possibly even cure the patient. At the end of the day, we as a group have been the innovators in the field. We are the group that have developed the concept of having disease-specific evaluations. The autoimmune epilepsy evaluation, the autoimmune encephalopathy evaluation, those were developed and originated from Mayo Clinic. And we are moving the field rapidly forward. Now, obviously, there are our industry competition. They will come, they will copy, and they will offer, but they're not really invested in understanding and discovery. All our profits go back into patient care and go back into discovery and development. They don't go to shareholders. And that's why I think we stand separate and stand apart, and that's why I think we are the lab that really will provide the best service. In our field, in this field, it's rapidly changing. And so if you want to be accessing the most up-to-date tests, then Mayo Clinic is the laboratory that you want to send your samples to.